Depression. It is a common mental health condition that involves persistent low mood. Depression differs from the mood fluctuations experienced regularly in life, and it is distinct from the negative feelings people may temporarily have in response to difficult life events. Depression causes persistent, intense feeling of sadness that is not proportional to a person's circumstances. Depression can cause a range of psychological and physical symptoms. The psychological symptoms include persistent sadness, feeling of guilt and worthlessness, feeling of hopelessness, loss of previous interests, as well as poor concentration and difficulty making decisions. While the somatic symptoms include sleep abnormalities, either difficulty sleeping or a tendency to oversleep, changes in appetite and body weight, loss of sexual desire, changes in menstrual cycle, as well as feeling of low energy and fatigue. Pathophysiology of depression. It is multifactorial, and to underline its complexity, a psychoneuroimmunoendocrinological theory has been introduced to describe depression. According to this theory, depression results from multiple factors including the monoamine theory, brain-derived neurotrophic theory, immunological disturbance, and inflammatory processes. Disturbances in hypothalamic pituitary adrenal axis, disturbances in microbiota gut-brain axis, oxidative stress, as well as genetic factors. The monoamine theory is historically the first hypothesis proposed to be responsible for the development of depression. The most common biochemical explanation is the deficit of monoamines such as noradrenaline, serotonin, and dopamine. These monoaminergic neurotransmitters play a key role in regulating mood, sleep, appetite, emotions, cognitive functions, and social behavior. The brain-derived neurotrophic factor theory of depression was developed as BDNF-mediated signaling in the hippocampus is involved in neuroplastic responses to stress and antidepressants. Chronic stress reduces BDNF-mediated signaling in the brain, leading to loss of neurons and glia, which results in development of depression. Immunological disturbance and inflammatory processes can play a causal role in the development of depressive illness. As the immune cytokines released during inflammation can pass the blood-brain barrier, causing activation of the glial cells to produce more inflammatory cytokines, leading to neuroinflammatory process and neuronal damage. Disturbances of hypothalamic pituitary adrenal axis. Stress induces overactivity of HPA axis, leading to hypercortisolism. There is a significant correlation between cortisol level and depressive behavior, as hypercortisolism can cause neurotoxic damage to hippocampus, resulting in depression. Disturbances of microbiota gut-brain axis. The microorganisms inhabiting the gut and their products are essential for the bidirectional communication conforming the microbiota gut-brain axis. Depressed patients show significant changes to the gut microbiota, a condition called dysbiosis, which may lead to neuroinflammation and neuronal degeneration in the brain, developing depression. Oxidative stress. It is involved in the pathophysiology of depression as it is closely related to inflammatory processes. In the course of an inflammatory process, a positive correlation is established, as inflammatory mediators intensify the synthesis of free radicals, such as reactive oxygen and nitrogen species, which in turn sustains inflammation and release of pro-inflammatory mediators. And both can act together to induce neuronal degeneration resulting in depression. Genetic factors. Estimates indicate that about 50% of depression causes are genetic. Possible genetic causes of depression include polymorphism in genes related to the neurotransmission of noradrenaline, serotonin, and dopamine. Polymorphism in genes regulating BDNF production. Polymorphism in genes regulating anti-inflammatory cytokines. Polymorphism in genes regulating nervous system development, as well as polymorphism in genes regulating circadian rhythm. To sum up, according to the comprehensive psycho-neuro-immunoendocrinological theory of depression, this disease results from the action of multiple factors. While 50% of the causes are genetic, about 50% are related to psychological or physical factors.